Hey community, this is Dr. Hugh coming at you again. I haven't done a webinar in a while, at least a longer webinar, and today I am pretty stoked because I'm going to be doing a webinar, as you can see, on red light therapy, or the fancy word, what we call photobiomodulation. So what the hell does that mean? That just really simply means that light in a particular frequency can help you out tremendously, and this just isn't some weird Dr. Hugh thing. There's actually tons and tons of research on photobiomodulation, which I'll be going over right now. But before I get into the webinar, so you understand why you want to use red light therapy, I just want to show you my unit. So this is my unit right here. This is from Platinum right here. This is a big unit. You can see how big it is right here. It's roughly 3 feet long. It weighs almost 33 pounds. I'm just going to turn it on and blind you, so watch your eyes. So this is the red light therapy right there. This is very, very, very strong. And as I walk you through the webinar, you'll actually understand why you want to buy one of these if you have any kind of chronic conditions at all. And not only for chronic conditions, I bought one because I want to maximize my life expectancy. I want to maximize my mitochondria, and this is scientifically proven to do that. So a lot of clients come to me and they are really messed up from antibiotics or just general life, and their mitochondria are really, really sick. So this is one way that we can actually get energy in your mitochondria is through photobiomodulation. All right, so as you can see here, full body light therapy has been proven to help people with skin health, muscle recovery, body contouring, mental clarity, athletic performance, joint pain, sexual performance, and sleep and relaxation. There are tons and tons of research on how red light therapy can help you with your chronic condition. This comes from PubMed right here. So what PubMed is, it's any kind of research article that's been published in the entire world ends up in this library, which is called PubMed. And you can see right in here, there's roughly almost 3,000, yes, 3,000 research articles on photobiomodulation. So this is heavily researched. So this here is a photosynthesis, and let me just kind of go over what this is. Really, like we all learned this in elementary school. We have the sun right here. The sun brings down its beam, it hits the plant, and that plant takes the sun energy and it produces something. It's going to produce corn or vegetables or leaves or apples or whatever it is, right? So there is power in the sun, and there's power in us utilizing that sun to restore mitochondria. Now, one of the things is when it comes to photobiomodulation is we can call illumination. Illumination. So what the heck is that? This is my belief. I personally believe that much of the positive literature around the benefits of red light correlates with a light deficiency. So if we don't have enough good light, if we don't have enough light in general, we're going to be deficient in something. And if we're deficient in something, red light therapy, then our mitochondria are going to be sick. Our bodies are not going to be optimal. And if they're not optimal, then let's say you have a whole bunch of these different insults that come in, like maybe you had antibiotic exposure, maybe you had COVID, maybe you have some kind of autoimmune disease, maybe you have a leaky gut, maybe a leaky brain, maybe you had concussions, maybe you've been motor vehicle accidents, maybe you've had sprains and strains. All these things accumulate, and if you don't get enough red light therapy, your mitochondria are going to be sick. Okay, so this next slide here, I need to get into a few technical aspects, but I'm going to try and make this as simple as possible so you understand, but you have to understand some kind of biology and how God designed us. So this right here, this comes from this study right down in here. So there's things in our body called chromophores right here, chromophores. So what the heck is a chromophore? Basically, you can just imagine a chromophore is basically what it is. It's a solar panel that's in your mitochondria. So really simply, a chromophore is the solar panel specifically located in your mitochondria. And it's specifically located at your cytochrome C oxidase. So that's just the map. All right. So I'm here in Minnesota. I'm here in Minneapolis. So basically it's saying that the solar panel is located in Minneapolis. This solar panel located in your mitochondria is located at the cytochrome C oxidase, which is in your mitochondria. Now, when God designed us, there's literally between 500 and 2,000 mitochondria in each cell. So our cells are loaded with mitochondria. All right, so what I'm going to show you right here is a diagram. So what we have here, let me show you the mitochondria. Okay, so this basically is the mitochondria right in there. Right now, we have the outer membrane, which is this like brown, light brown area. Then we have the the mitochondrial membrane, which is that green area right in there. Now, on the inner mitochondria membrane, this is where all the solar panels are located. Now, these solar panels, there are thousands and thousands and thousands and thousands and thousands of these solar panels located in each mitochondria. And remember, each cell has between 500 and 2,000 mitochondria. So you have these solar panels, which are located in the mitochondria, and the fancy word for these things is called cytochrome C oxidase right in here. So the cytochrome oxidase is located right in here, and you can see, again, this is just some technical aspects. When it comes to the mitochondria, you can see this you can see this 1, 2, 3, 4, and these are connected, and then 5. So basically, there are 5 steps in the process of creating ATP, which is the energy that we're looking for. So if we have good ATP, our batteries are going to be highly, highly charged. Now, if you're going to see up here, PBM stands for photobiomodulation. So this light, the red light, comes in here. It charges step number 4 in your mitochondria, and that's where the solar panel is located, right in here. And this charges things up, and specifically, the cytochrome C oxidase allows the red light to get in there, and it starts creating more energy. This is where it's so critical. Now, if you're illumination, meaning you don't have enough red light, you're not going to be charging your battery. Just like Tesla. We have a Tesla. And if you don't charge the batteries, you're going to run out of juice on the road. This is the same thing that happens in your mitochondria. Is your mitochondria will literally run out of juice. So when we talk about restoring someone's health, restoring someone's function, it's always a polytherapy approach. I don't think this is the holy grail. I don't think changing your diet is a holy grail. I don't think taking vitamin D is a holy grail. What is the holy grail is a polytherapy approach that has multiple therapies where we combine things and looking where your weak links are and then moving forward to get you better. All right, so here's just some geeky stuff. Cytochrome C oxidase is located in complex number 4, which is that's just the 4th step in the energy process. Okay, so you can see right here, this is step 4 right in here. So these next couple slides come from a really, really great book right here, which is called The Ultimate Guide to Red Light Therapy, How to Use Red and Near Infrared Therapy. So this is a diagram right in here, and you can see here the cytochrome C oxidase comes in here, the red light therapy. This is the red light therapy, and it activates this area. And I'm just going to kind of read what the author states. So cytochrome C oxidase is part of the respiratory chain, just meaning that's where energy comes from. That's the engine. Inner mitochondria that plays a key role in producing ATP. When red and near infrared light, that just means there's different types of red light, and I'll explain that in a little bit. Photons hit basically the cytochrome C oxidase. This helps mitochondria use oxygen and produce ATP. So what the heck is this saying? This is saying is when you use red light therapy, it's going in, it's hitting the specific solar panel at step 4 in the mitochondria, and that is causing you to use oxygen more efficiently, and this causes you to produce more energy. Now, so this is step kind of number 1. Number 2 here is also what happens is you can see right in here. So this here is your mitochondria, and then there's things in your mitochondria. This NO stands for nitric oxide. Now, you see right here, this would be a sick mitochondria. This would be a mitochondria that we are using red or near infrared light. Now, what happens is in your mitochondria, nitric oxide stays attached very closely to stage number 4. Step number 4, the nitric oxide is really tightly bound to there, and oxygen cannot get in there and start producing ATP. Now, what happens when you have red light therapy? Red light therapy kicks out the nitric oxide. So nitric oxide is out. Then what happens here? Then the oxygen comes in. So you can see the difference here. You can see how many nitric oxides are here, how many nitric oxides are here, and then you can see how much oxygen is here. So we use a lot more oxygen. When we're using more oxygen, we're increasing ATP, which comes from the mitochondria. If you can increase oxygen in your mitochondria, increase ATP, you're going to have healthy mitochondria. Now, one of the things that happens, if you've seen any of my lectures, I have some stuff on my website about nitric oxide. Once nitric oxide is kicked out of the mitochondria, oxygen comes in and it can start to produce more energy. Then what the nitric oxide does is this is called a vasodilator. What does that mean? That causes your arteries to dilate. Why would you want your arteries to dilate? Because you can get more blood, nutrients, and oxygen to the rest of your body parts if the nitric oxide is not sitting in your mitochondria, but it's out in the field doing what it needs to be, doing what it needs to do. So right here, to have great mitochondrial function, we want to kick out the NO, nitric oxide, from the mitochondria and get the oxygen in. So that's the second thing. Now, the third thing, this is very, very, very critical. This comes from a research paper from the same book right here. So what happens is when you put red light therapy on your skin, right? It doesn't hurt. There's like a gentle warmth feeling. What happens is the water becomes more fluid-like. So what you have to realize, this is the steps here. This is the stages. This is stage. This would be stage 1. Here's stage 2, here's stage 3, and here's stage 4. So 3 and 4 are combined. And then right here, you actually have this end unit right here. This is the ATP pump. This actually produces the ATP. Now, this thing spins around just like a boat motor. It's spinning around. Now, what the research suggests is the water in your cells, the water in your mitochondria become more fluid-like. So imagine swimming, right? Imagine swimming in a bowl of jelly or normal water, right? What's going to be easier? Obviously, swimming in water is going to be much more easier than swimming in a bowl of jelly. So what happens here is when you use red light therapy, the water in your cells becomes more fluid. It's easier to move around. And when that's easier to move around, what happens to this ATP pump? There's not as much tension on here. So this ATP pump can move around quicker and quicker and produce more ATP. Now, what I want to get in here is the red light therapy. And this took me lots and lots of hours to actually understand this. So if you're listening to this or seeing these principles for the first time, you're going to have to go back and rewatch this video. You want to go to other YouTube videos and look so you get a different viewpoint so you can understand what's happening. So when it comes to what we can see physically as human beings, it's a wavelength. Now, the wavelength is 380 to 700 just nanometers, okay? So inches, centimeters, it's just a measurement of a wave. And these different waves, we as humans perceive them in different colors. Now, the machine that I just showed you initially is called, it's a platinum machine. You can go and you can Google platinum and it will come up. The website will come up. Now, this is really important here. Now you see here blue light, red light, and then you see near infrared. So what the heck does near infrared light means? That means that you can't see this in here. You cannot see this light right in here. It's there, but you can't see it. Just like the cell phone. If I pick up my cell phone right here, there's waves coming in the cell phone. You can't see them. It's there. Same thing if you stick something in the microwave and you turn it on for a minute, you can't see the waves, but you know it's there. How do you know it's there? Because when you take your food out, it's warm. So when we talk about red light therapy, we want to have the red light. Basically, the red light is it's measured in different like measurements, right? So we have blue light weight down here, and then we have 630, 660, 810, 830, and 850. Now anything from here, this area right here, you cannot physically see. But what is this actually doing? This is actually penetrating your skin, getting in the mitochondria. It's getting in stage 4, right? Step 4, that's the solar panel, and it's creating more energy. It's creating more ATP. It's causing the nitric oxide to be excreted from the mitochondria. And when the nitric oxide is excreted from the mitochondria, oxygen can come in there, and then oxygen is what's needed to produce ATP. So when we talk about a red light therapy, there are different wavelengths that you want to utilize to get the maximum benefit. Now, again, I'm just trying to show you the visual because it took me a long time to understand this, right? So we see from 380 to 700, right? So 700. So to give you, this is the eyesight right here. So this right here is the visible light right here, 380, 700. You can see, you can physically see that. Now, when we talk about near infrared, that's like in this zone right here, this purple area, in this area right here. You see this right here, near infrared. So it's called near because it's near the red light. It's infrared. It's near the red light. So this red light right here, or I shouldn't say red light, this infrared right here, you can't see that, but it's penetrating the mitochondria. So we're talking 810, 830, and 850 wavelengths. Now, same thing here with microwave ovens, right? This is the microwave. It's a higher wavelength. So this is why you can't see it, but we know it's actually doing something. Here's another visualization of this thing, just because it took me lots and lots of pictures to actually wrap my head around this. So we have visible light right in here. So this, see this little slice right here? Out of all the wavelengths, when we talk about light, visual light, we're just talking something so small here. So we want to use basically the light from in here and a little bit like up in here. This is what we're looking for to get those benefits of the mitochondria. So if you're interested in this, this is the Platinum. This is the website right in here. Now, on their website, this is a great website. It's going to show you what the 480 does. This is like a little blue light. Then we go to 630. So 630 wavelength right here. This is what this does in here. You can see that. Now, if you want to geek out and look at these closer, just stop the video. Then we go to wavelength 660. And this is where we get reduced fatigue, reduced inflammation, improve bone healing, reduce swelling, reduce basically neuropathy pain, accelerated wound healing. Now, you have to realize all this stuff is occurring because of mitochondria. If we're illumination, if we're malnourished on light, and all of a sudden we give your body light, we give your mitochondria light, what's going to happen? Healing is going to take place. Healing is light. Right? You go out in the sun and you feel good. Why? Because that is healing. We do not have enough sun. Ever since COVID, people are sitting in their houses, sitting at computers, sitting on their phone, getting this bad light. We're not getting the good, healthy wavelength. Here we have 810. Now we're sitting right in here. Improve healing and recovery, accelerated wound healing, improves if you have a stroke, improves recovery from traumatic brain injury. They've done tons of research on Alzheimer's disease, Parkinson's disease, any kind of neurological diseases. This helps that. Psychiatric disorders, this helps that as well. So why? It's not like it's some kind of super magical thing. We're giving your body what it doesn't have. If your body doesn't have something and you give it what it needs, it's going to get better. And this is specifically targeting the mitochondria. So when you do the red light therapy, it's quick. It's like 10 minutes. You do it on the front side, you do it on the back. This is penetrating your skin. It's getting in the mitochondria. It's actually getting in your blood and exciting your blood as well. There's so much research on this. I mean, I don't have time to go through everything here. Here's the 830 wavelength right here. Reduces infections. What's happening? A lot of people are coming because they have what? Chronic UTIs, chronic H. pylori, some kind of chronic infection. After surgery, it's a feel-good endorphins, bone repair, psychiatric disorder, and you recover quicker after training. Then we have down here is the 850. Anti-inflammatory benefits, enhance muscle recovery, healing of skin wounds, reduce lines and wrinkles, and it's actually being used for like tooth alignment. So this is what I wanted to take some time and explain. I haven't done a long video like this. So red light therapy is, in my viewpoint, a huge clinical piece that is missing. If people don't get enough light, if people don't get enough red light and infrared light, you're going to be malnourished for light. And what happens if you have a chronic disease? You're inside all day. You're not getting any light. If you live in the northern hemisphere, you're not getting light, period. And on top of that, you're sitting inside because you have a chronic kind of disease. And these are kind of the people that I see, people that have chronic illnesses. So I very much appreciate you being here. If you've enjoyed this content, please like, comment, and share this with a loved one. Take care. Bye-bye.